It's Gray Matters, and today's show will be a special about healthcare and healthcare reform, the potential for the future. We have Lee Mercer, who grew up where?
Oh, actually, I was born in Salt Lake City, and I grew up in the Silicon Valley in California. I've been in Oregon 8 years.
Is a chip off the old Silicon. Okay, good. We're going to get right into, we're going to get indirectly into healthcare. We want to know a little bit about, since you're sort of an activist today, where did your bug bite for activism begin? Can you give us a little of your early history about some of the causes that embraced you? And
Yeah, funnily enough, I started out most of my adult life, I was in small business myself, and I ran art and foreign movie theaters like the Salem Cinema here in California and Nevada. And I did that for a number of years, so I was a small businessman most of my life. Then I moved over to the coast of California. I started a job at a food bank, and I started to learn there's a lot of people that are hungry and poor in this country. And I started getting involved in advocacy work where we'd go up to Sacramento and work on state and federal policy, go to DC too, and work on state and federal policy dealing with how do we deal with poverty and inequality of income and so forth. And when I moved up to Oregon for some health issues of my wife's son, we moved to Silverton, Oregon, and I actually became part of a group called Oregon Center for Public Policy, working on budget and revenue issues around poverty and social services and education.
I know Chuck.
Right, Chuck Sheketoff was my boss for quite a while. And then from there, I was hired to run an organization called Main Street Alliance of Oregon, where we were kind of getting small business owners active on policy issues. And I went around the state and went door to door, business to business on the main streets of Oregon, from like Ontario to Astoria and from Pendleton down to Brookings. And I interviewed small business owners. And we talked about various policy issues, but I heard from them that many of them are struggling. They can't afford to give their employees health care. This was a couple of years ago. Many of them couldn't afford to pay for health care themselves, and many had stories, I mean, really sad stories of bankruptcies and not being able to get insurance because they had cancer. And I began to realize that health care for business was a big issue. So with my Main Street Alliance work, I stumbled onto this organization, Healthcare for All Oregon, which is working on moving us toward a healthcare system more like they have in Canada, where basically there's a single payer. In Canada, it's the province that pays all the bills for healthcare. You pay your taxes, you get your healthcare, that's it. You don't have insurance companies, you don't have co-pays, you don't have deductibles. And Canada spends about half as much per person on health care as we do here, and gets better results.
How long, Lee, has Canada been doing this?
They began it in Saskatchewan in the early 1960s. A prime minister named Tommy Douglas said, "Health care is a human right. We're going to have it for everybody." And they fought for it. They made it. The doctors went on strike for 23 days, but they came to an agreement, and within a few years, all of Canada had this universal publicly funded health care, and no more did people have to worry about health care bills.
And what was the experience? Do you get any feedback from what's happened in Canada? The consumers, the patients, they're pretty happy with the way it's gone?
We share one thing. Recently, a few years ago, the Canadians all over Canada voted for the most popular, most important Canadian in history, and it ended up being Tommy Douglas, that prime minister that passed the health care program. They called it Medicare, actually, and that's what their system started out being called. But we have a film that we've shown around the country quite a bit called the Healthcare Movie, and it interviews dozens, or actually hundreds of Canadians, and the majority of them appreciate their healthcare system. There's some complaints about if you have a elective surgery, you may wait a few months for a service, but in general, they love their system.
So, do you have any idea of how many people in Canada are served, or Are there any statistics?
Well, everybody's served.
Everybody's
That's
served.
the kind of system
What's
we're
the-
advocating for here in Oregon.
What's the most popular surgery that they do?
Oh, well, I wouldn't know that.
I don't know that either. A cut above. Okay. Anyway, is medicine also covered like it is now? We have, I think it's Part D in the Medicare. That,
Yeah.
So that's, everything is covered? Nothing is left out?
Our current bill, and what you might characterize this as improved Medicare for all, because right now Medicare is still a little cranky because you got part this and part that and part this, and you got prescription over here. The system that we are describing, we're calling it Healthcare for All Oregon plan, and in that plan it would cover medical, it would cover pharmaceutical, it would cover, hospital, all the things you associate with medicine that are medically necessary would be paid for by this system.
Including hospice?
Yes, and...
I used to work for Douglas County Hospice.
Right.
In Roseburg.
Right. That would also, in the current iteration, it would pay for dental and vision, but that's for the citizens to decide how comprehensive a system they really want.
Okay. And when you go about organizing and getting people interested in this, what's your approach to motivate them to learn about your system?
Well, we
your
have
plan,
chapters of Healthcare for All Oregon around the state. We have 14 chapters. We are a coalition, so we have 120 member organizations, from unions to churches to community groups, and we have about 17,000 people in our database. So we're out at farmers markets talking about it. We're having house parties. We're showing the film Healthcare for All Oregon. We have another film called Fix It, Healthcare at the Tipping Point, that shows this kind of healthcare system as the solution for businesses that are struggling with the costs of healthcare, because all businesses are struggling with the healthcare costs.
Now, I have an impertinent question. In every society, there are liberals, moderates, and conservatives. Conservatives tend to be more resistant about investing funds in new projects. Is there a way that, let's say we do a pilot project of this healthcare for all in 3 or 4 counties of the state and see how it works, so it's to convince everyone else that, it's worth doing, rather than to do it overnight, or not even overnight. All counties would do it in one fell swoop. In other words, you have a comparison, so that the pilot project can prove itself, and the doubtful legislators can then see, hey, it really does work, and it's worth investing in because you've saved such and such, and however you grade the efficiency of healthcare. Can that be done?
It's an interesting idea. Part of making this work is, if you do it at the state level, then you have a large enough economy and a large enough base of people paying into the system to make it work for everybody. So it might be that it's too small, but maybe, say, in the metro area, in the Portland metro area, since about half the population of the state is there, you could potentially experiment with something like that.
You could do that. They're having a new mayor election coming up, and that would be an opportunity to have them do that. Eugene is another more liberal city in our mixed red and blue state.
And I want to clarify, though, that we don't view this as a liberal, conservative issue. In Taiwan, that passed a healthcare system like this, it was the liberals that, at one point, the Conservative Party got out in front on this and actually passed it in Taiwan, because as business owners more and more are finding, this is a cheaper way and more inexpensive way, a more cost-efficient way of providing health care, and it gets business out of the business of managing health care.
So do you make presentations at Chambers of Commerce?
We do. We make presentations at Rotary Clubs, League of Women Voters, Chambers of Commerce. We're really looking for business groups to look at this film, Fix It. I showed it to the Global Benefits Manager for Intel Corporation.
Let's mention your website then, and the phone number for people to call you later.
Yeah, our website is hcao.org, and go to the website to get the phone number of our office in Portland.
Okay, good. Do you have any events coming up in April? This will be showing. We're rehearsing. We're not. We're taping today, but we will be going public in late March. So what's coming up in late March and April?
We have actually our biggest fundraiser of the year is billed as the Inner City Blues Festival. We've been doing this for a couple of years. It's the 5th annual Healing the Healthcare Blues. It features Norm Sylvester and a number of the biggest blues artists in Oregon. It's Saturday, April 16th in the Eagles Lodge, the North Portland Eagles Lodge. You can get tickets at tickettomato.com.
Good. Okay. And if people want you or someone else as a speaker to speak before their club or senior center or whatever, where would they contact?
They can get my contact information on the website at hcao.org.
Okay. MERCER, not to be confused with Mercy Hospital over Mercy Medical Center.
Or Johnny Mercer.
In Roseburg. Okay. So good. Have you visited any other countries where you've seen the healthcare system similar to what you propose?
One of the people that spoke for us, I've been in several countries, and in all of them they tend to have some kind of public health system going in France and Spain, et cetera. But we had a speaker last year, T.R. Reid, who wrote the New York Times bestseller, Healing of America, and he described the healthcare systems in Britain, Canada, Japan, Switzerland, Germany, and a number of other countries. And and it's clear that all the civilized, industrialized countries have systems that cover everyone, and it ends up being more cost-effective, and it has better health outcomes in terms of mortality rates and infant mortality.
I'm glad you have evidence to back this up. I'm going to put in a little plug for something because I just got out of surgery 2 weeks ago, and I don't know if it would fit into your system quite or not, but when you go into a hospital, you almost sign a blank check at the point of admission.
Yeah.
You sign a contract with the hospital saying that whatever the insurance won't pay will come out of my pocket, as deep or shallow as it is. I would like to advocate, and maybe your group could have this as a dovetail supplement, that whenever you sign into the hospital, you get a laundry list of uncovered items not covered by your insurance. The hospital only deals with maybe a dozen or so different insurance companies. They can easily figure out what are the non-coverable items. It's not going to take a heck of a lot of time, and I think it's a consumer right to know in advance and not just go in blindly and saying, okay, like a doctor may prescribe a medicine. Now in the hospital it costs 4 or 5 times as much as you do. If it's a medicine that you don't absolutely need, you have the right to refuse it, but you should know in advance that if you don't need it, why pay for it? Because the doctor has it on his agenda or her agenda, not necessary. And like if you have somebody visiting your room and they order a meal along with you, they have to pay, or you pay out of pocket for their meal.
Yeah, we actually, in the last session here, and not this session, but the 2015 session, some of our allies in the Capitol are working on a bill for transparency in hospital prices. Now, it didn't pass the last session, but a number of the folks we're working with are interested in a hospital price transparency bill. Until we get to universal health care, we as consumers, because they're considering as consumers of health care, we need to know what the prices are.
I agree. So maybe we could have for the next session a mini bill that just takes the step of listing the non-covered items by your given insurance plan.
Yeah.
And I also want to mention that you can call the billing department of your hospital and ask them in advance what they pay and what your copayment will be before you sign in. Okay. So any closing thoughts about healthcare for all and what it constitutes? We have about 10 seconds left.
Yeah, just that folks should go to hcao.org. We are Healthcare for All Oregon, and we have local groups around the state. Get involved and make your voices heard with your legislators and let other folks know that we need universal health care.
Okay. Thank you for tuning in. Stay healthy.